There's a lot of things that can go wrong with the human body, whether that's pain, whether that's organ dysfunction, or whatever it may be. There's a lot of named diseases and a lot of syndromes and a lot of conditions. But most of the time, you can trace that back to a nerve problem. Let me explain what that means. A nerve problem doesn't necessarily mean I'm going to have pain. There's a lot of different nerves in the body. There's nerves that transmit pain, there's nerves that go to muscles, and nerves that go to organs, and a lot of those just carry information. You could put pressure on them and pinch them, as we say, a pinched nerve. Doesn't necessarily mean it's going to be pain, but whatever's at the other end of that nerve isn't going to work the way that it's supposed to. Let's think about if it's the nerve from your brain that runs into your stomach. If that communication is impinged, if that nerve has pressure on it, your stomach's probably not going to work right if we don't get the right communication. So regardless of what is going wrong, again, very often it's a nerve problem. Let me explain a little bit better. So we all know that our brain runs our body, right? We've got to have information from the brain out to the body to do really anything, right? To perform any function that we do, whether those are the things we think about or the things that just go on that we don't think about, breathing, digestion, kidneys filtering, whatever it may be. So we have the brain here. We've got the tail end of the brain, which is called the brainstem. The brainstem is vitally important. It sends information up into the brain about position, sense of the body, sends information down to the body from the brain about how we're supposed to function. And what allows us to be healthy is a constant loop of information from the brain to the body to the brain, all day long, every day. The closer that is to 100%, the more likely we are to have 100% health. So if something happens up here, we have a slip, we have a fall, we have a car accident, whatever it may be, we're a kid learning to walk, and maybe even when we're coming out of the womb, there's some sort of pressure or pull on the neck, we can misalign one of these top bones up here. When we misalign those bones, we're going to get pressure in here on the brainstem. If we get pressure on the brainstem, just like we said, we're getting pressure on the nerve, somewhere along the chain, something is going to break down. If that is, again, the nerve from the brain to the stomach, we're probably going to have some digestive issues, whatever that may be. If it goes to the liver, we're going to have some toxicity issues and maybe some body inflammation. And sometimes, sure, it's pain. We get a pinched nerve up here, we get this bad radiating pain down the arm, and we're miserable. But whatever it may be, most of the time a breakdown in the body is a breakdown in the nervous system and that communication. And it's why I see so many patients, regardless of what they come in here for. Maybe they come in here because they have numbness in their left hand, but while they're under care, we find out that their depression is gone and their digestive issues go away. Whatever that may be, it can have a drastic effect on mental health. If the brain isn't getting the right information and the right signals up, things get a little jumbled. If we get the wrong hormones, suddenly we're not feeling the way that we should and things aren't working right. And that happens above and below the neck, wherever it may be. So that's why we can say it's generally a nerve problem. And if we do have a problem, it's better to take that pressure off the nerve, get the body to communicate properly, rather than throw a pill at it and to throw a shot at it or a surgery or whatever that may be. Usually, sometimes that's a stopgap and sometimes it's a failed thing, right? But we're trying to do whatever we can. We all want to be well. But if we get inside and get to the core of it, we tend to do much, much better if we remove the initial problem rather than just slap a Band-Aid on it.